Hello everyone, welcome to the part 2 of Oral Pathology Syndromes. First of all, we'll start with Crouzon syndrome. So Crouzon syndrome is also known as craniofacial dysostosis. It has characteristic prognathic mandible, hypoplastic maxilla, high arched palate. If we see in the image, we have a prognathic mandible, hypoplastic maxilla, a copper beaten skull, and high arched palate is seen. Characteristic parrot beak appearance is seen. If you see in the image, it exactly looks like a parrot beak. Frog shaped face because of the hypertelorism, that is the increase in the distance between the eye, is also seen. Next is the Apert syndrome. So Apert syndrome, it has syndactyly involving hands and feet, also known as mitten hand and sock feet. If you look in the image, here we have connected fingers, which is syndactyly or mitten hands. These are the other features of Apert syndrome. Comes next is the Treacher-Collins syndrome. Treacher-Collins syndrome is also known as mandibulofacial dysostosis or French-Chetty syndrome. It is associated with the gene TCOF1 gene. It is easier to remember. T goes with Treacher, C goes with Collins, and also known as French-Chetty syndrome. So I have made a simple way to remember it. That is TCOF, Treacher-Collins of French-Chetty 1 gene, like that. Then it has a hypoplasia of mandible and malar bone. It is exact opposite of what comes in the craniofacial dysostosis. Here we have hypoplasia of mandible and malar bone. High arched palate is seen. Bird or fish like face is seen. In that we had a frog and parrot beak like face. Here we have bird and fish like face. Then here coloboma of eyes is seen, that is congenitally missing tissue in or around the eye. Now next comes the Perry-Robin syndrome. Perry-Robin syndrome has an anomalid. It does not have a triad. It is not called triad. It is called anomalid because first this is seen, later this, and later this. Means micrognathia leads to glossoptosis, which leads to cleft palate. So you can appreciate the image. We have a high arched cleft palate, then large tongue obstructing the airway, that is glossoptosis, and underdeveloped chin, that is micrognathia. So these are all the reasons, that's the sequence which causes the Perry-Robin syndrome. Next is the Marfan syndrome. Marfan syndrome is associated with FBN1 gene on chromosome 15. It has a bifid uvulae, then multiple ocases, hyperextensibility of joints, and spidery fingers. We have syndactyly in Apert syndrome. Here we have spidery fingers. If you can appreciate in the image, it is associated with 15 chromosome of FBN1 gene. Okay. Next is the Down syndrome. So Down syndrome has a characteristic trisomy 21 which leads to Down syndrome. It has macroglossia, poor oral hygiene, which leads to increase in the number of caries. If we look at this child which has Down syndrome, he has small head at birth, abnormal ears, flattened nose and face, white spot on the colored part of the eye, and splinting eyes. The main feature of Down syndrome is simian crease, which is present on the hand, short fifth finger that curves inwards. Okay. Foot has widely separated first and second toes and increased screen creases. This is Down syndrome. Next comes the Greenspan syndrome. Greenspan, here it is the triad of lichen planus, vascular hypertension, and diabetes mellitus. BP, diabetes mellitus, and lichen planus, a triad which is known as Greenspan syndrome. It is GRIN, not GREEN. Okay, keep that in mind. This is IN. Next comes the Reiter syndrome. So Reiter syndrome, the easy way to remember is MUAC, MUAC. MUAC. That is mucocutaneous disease. urethritis, arthritis, and conjunctivitis. It has a tetrad, which is Reiter's syndrome. Okay. Next is the Horner syndrome. It is also known as cyst syndrome because it has cysts at the back of each sign seen, that is ptosis, meiosis, and anhydrosis. Okay. Ptosis is drooping eyelids, meiosis is constricting pupil, and anhydrosis is loss of sweating of the face. It is also known as cyst syndrome, that is Horner syndrome. Next comes the Ramsay-Hunt syndrome. If you all know, Justin Bieber was one of the patients who had Ramsay-Hunt syndrome. So it is caused by varicella zoster virus, herpes zoster infection of the geniculate ganglion involving external ear and oral mucosa. Facial paralysis is also seen. If you can appreciate in the image, there is a facial paralysis seen. So this is a characteristic sign. Okay, so thank you everyone. This were the few of the syndromes which are very important for oral pathology for both NEET MDS and INI City. So stay tuned. Thank you very much.